NIMHANS has been seized with this plan of preventing suicide ever since a couple of decades or even more. There have been specific therapies that were started in those who have been talking about suicide. There have been public health related research that has been done on suicide. We are now more eager and serious about how to prevent this as well. So there are several methodologies, several training programs that are given to not just professionals but also to lay professionals, lay personnel who can become informed about suicide, its risk, how to identify and how to actually counsel these people who are harboring these thoughts from getting out. Whenever such a thought is seen, look if this is related to a psychiatric disorder or an event that is lingering in their family, and then attend to those things appropriately. If it is a psychiatric disorder, it is a good idea that they meet a mental health professional to get more help from getting over these thoughts. But if it is some situation that it is bothering, socially responsible people can be called in. Above all this, there are what we call as suicide helplines, which have been in vogue. However, the success rate of the suicide helplines is something that needs to be investigated. Above all, lay counselors who can be, who have now called as gatekeepers of suicide prevention, have been finding a place in the community. NIMHANS has made a beginning in this area from years. We have been training gatekeepers who will come to the rescue of such people who harbor suicide thoughts. And we have also initiated at some point of time helplines during the examination results season, when adolescents, particularly when they get to know their results, make such attempts. And to help them out, we have been doing this. We also have been doing health education brochures, particularly in the media during the periods when the examination results come out, to impress upon the children and also the families that examination result itself is not the end in all. They can progress well and make a better life if they avoid suicidal thoughts and suicidal attempts. On 10th September, we are observing the World Suicide Prevention Day. Indeed, it is a very important event. Suicide is a potentially preventable mortality in the community. We know that several people end their life, and the newspapers and the media depict this news. Please remember, for every such one patient or one suicide death that we hear on the news or read on the news, 15 or 20 of them would have made an attempt at suicide. So 1:20. Some say it is 1:15. However, the magnitude is something alarming. Above all this, those 15 people who have attempted suicide, 10 times more that number or even more than that would have been harboring these ideas of suicide. The National Mental Health Survey detected that this ratio of completed suicide to suicide attempt to suicidal ideation is 1:15:200, which means if we can locate these 200 people and educate them and be with them and help them out, we would probably be preventing the next 15 people who are going to make an attempt, And amongst those attempters, if we start applying our mind, we would probably be able to prevent this completed suicide as well. We know that among the completed suicide people, a good number of them would have made an earlier attempt which has not been successful. So given this public health importance of suicide, let's all take cognizance of this, work in our community, identify those who may be harboring these ideas, identify those who may be even planning these ideas, and help them out. Lastly, a tip to the media. Often in our enthusiasm to give this news about suicide, we may be inadvertently glamorizing this event. This is something that we can prevent consciously, make the news less graphic, and make also the news less highlighted so that people don't imitate such actions which are read in the newspapers. News items about celebrities making either an attempt or making a completed suicide also should be underplayed as far as possible, lest others start observing this and imitating these things. So here, friends, let's all join hands together. That is the theme of the World Suicide Prevention Day, to help our fellow citizens from getting over this thought and also help the society in preventing this serious mortality, that is suicide. Thank you.